fluid assessment can be done qualitatively and quantitatively. It's very important. You do it both ways. The first is qualitative assessment, and qualitative assessment can be done by looking at the area which is occupied by the fluid and the volume which is occupied by the fetus and placenta. So need to have a visual comparison between these two things. In the early part of the gestation, the first and early second trimester, if the volume of the communicating intrauterine pockets of fluid is equal to or slightly greater than the volume which is occupied by the fetal parts and placenta, it's normal. You can understand it as if in the first trimester while you're doing NT&B scan or the early second trimester, if another baby can fit into that cavity, qualitatively this amniotic fluid is adequate. Okay. So the volume occupied by the fetus and placenta should be almost equal then to the volume which is being occupied by the amniotic fluid. That is the qualitative assessment. It's very important in early trimester where semi-quantitative measurements don't work and they're not applicable, and in later gestation when you just want to have a global visual assessment. The semi-quantitative methods include amniotic fluid index and the deepest vertical pocket. It's very important, you should know both of them, how they are done. And after 20 weeks of gestation, either of these methods can be used to assess the amniotic fluid volume. Starting with AFI. Before doing any measurement, before turning on the caliper, take your probe and sweep through entire uterus to look for all the pockets that you can see. Just keeping probe on the lateral edges of the uterus will not help you. The uterus is to be screened fully. First visualize completely, then you divide it into 4 quadrants. Okay, your probe should be perpendicular 90 degree to the surface of the maternal abdomen, and then you measure the maximum antero-posterior dimension in the largest pocket that you could see in that quadrant. Exclude cord, exclude the fetus parts while taking this measurement. So see, this is the probe. Now it is held perpendicular to the maternal abdomen. Before choosing the particular pocket, I believe you have screened the entire uterus and you found this is the most reasonable pocket of fluid that can be measured. So once you see that, take the maximum antero-posterior measurement or in each of the quadrant, add them up and you get the AFI. It's as simple as that. So start measuring from the superficial edge to the deep part in that quadrant. Now that can be the part of the uterus or it can be the fetus. But remember, this is very important and often missed. The fluid pocket that you are measuring should be at least 1 centimeter wide. So if I'm taking this pocket, the width of the pocket should be at least 1 centimeter or more. Then only there is a benefit in measuring that fluid pocket. And once you have chosen such pockets, add them up and you get the AFI. In the deepest vertical pocket measurement, first of all, again, you will screen the entire uterus. You screened the entire uterus and you found this is the best pocket. So identify the single largest fluid pool and then measure it. Now, what is the difference between DVP and AFI measurement? The first and foremost is DVP can be there anywhere, especially central. So if you have a central pocket of fluid, you can use the DVP technique. In AFI, you tend to measure the quadrant, so you often miss the central part. So the pocket can be central in cases of DVP. Again, the inclusion criteria is same. Pocket should be at least 1 centimeter wide to be able to be included in the measurement. Now, what happens in severe oligohydramnios? There is not even a single pocket which is 1 centimeter. wide to take the measurement. So what to do in such cases? You will report it as severe oligohydramnios and few non-measurable fluid pockets were seen. There's no need to give a specific number in such cases because there is no measurable pocket. Less than 1 centimeter, don't measure it, otherwise you're going to overestimate the AFI. So DVP tends to overdiagnose polyhydramnios, AFI tends to overdiagnose oligohydramnios. Therefore, DVP is used for diagnosing oligo and AFI for poly. So now in this session, we are focusing on oligo. So our focus is on DVP. So what if you have twins? How do you measure AFI in twins? Anyone? If you have twins, you write the amniotic fluid is adequate. So do you use AFI or you use DVP? Anyone using AFI in twins?